Every day, millions of athletes drop a scoop of white powder into a shaker cup and assume the job is done. They believe that because the powder dissolves in water, it automatically dissolves into muscle tissue. This assumption is the passive absorption fallacy. Creatine does not simply drift from the bloodstream into muscle tissue by chance. The skeletal muscle cell membrane is a highly selective wall. Without a specific active gateway, circulating creatine is completely locked out. Supplement efficacy is dictated by the electrochemical environment of the muscle cell at the exact moment of ingestion, regardless of the dose. Gaining entry requires a precise biological sequence: active transport channels, energy triage overrides, and hormone-mediated amplification. Recovering the 30% deficit in absorption potential requires architecting the cell's internal environment to treat the intake as a pharmacokinetic system. This 3D model of a skeletal muscle cell membrane represents the molecular bedrock. Embedded in the surface is a single, closed protein channel. This is the SLC6A8 transporter, the exclusive entry point for creatine. Notice how a lone creatine molecule is instantly rejected. SLC6A8 is a co-transporter. It's physically incapable of moving creatine across the membrane unless it binds with a secondary molecule first. The cell spends continuous energy to maintain a steep electrochemical gradient, hoarding sodium ions outside the membrane. For the gateway to function, one sodium ion and one creatine molecule must dock simultaneously. This triggers the channel to rotate, releasing both molecules into the intracellular space. The kinetic energy driving this rotation comes entirely from the force of the sodium gradient attempting to equalize across the membrane. When systemic sodium is low, the extracellular gradient weakens, stripping the transporter of its driving force. This weakened gradient reduces transporter velocity, leaving unabsorbed creatine stranded in the bloodstream. Without sodium acting as the electrochemical power source, the SLC6A8 gateway remains a cellular bottleneck, rendering massive supplement doses biologically useless. Beyond the membrane gateway, the systemic fluid balance of the cell determines whether these channels are allowed to operate. AMP-activated protein kinase, or AMPK, serves as the cell's internal energy crisis monitor and triage system. When training intensity or low water intake depletes extracellular fluid, the cell membrane experiences osmotic stress, triggering a pulsing alert from the AMPK system. AMPK interprets this osmotic stress as a critical threat to the cell's ATP reserves. Active transport mechanisms require ATP to run, so AMPK immediately flags them as non-essential energy drains and halts their operation. AMPK actively downregulates these transport channels to preserve core survival functions. Ingesting creatine while dehydrated forces the supplement to compete directly against the body's survival programming. Cellular dehydration triggers an enzymatic alarm that actively locks the creatine gateway. The optimal pharmacokinetic environment involves the post-workout introduction of carbohydrates and the resulting insulin spike. In this context, insulin acts as the master signaling amplifier for nutrient uptake. This microscopic view shows insulin triggering rapid vasodilation by a nitric oxide release, increasing the volume of creatine physically delivered to the muscle membrane per minute. Insulin molecules bind to surface receptors, hyperactivating the sodium-potassium pumps to maximize the electrochemical gradient. This hypercharged gradient pulls creatine inward through the SLC6A8 gateway at maximum velocity. Insulin also triggers the translocation of GLUT4 vesicles to the membrane to ingest glucose for glycogen synthesis. Creatine acts as an intracellular osmolyte, drawing water molecules into the cell alongside it. Every single gram of glucose stored as glycogen simultaneously co-stores 3 to 4 grams of water. This creates the double hydration effect, where creatine and glycogen pull immense fluid volumes into the cell simultaneously through independent pathways. Carbohydrate co-ingestion transforms the cell into a highly sensitized nutrient vacuum. Industry discussion often dismisses creatine-induced water retention as a cosmetic side effect. Examining the structural consequences of the double hydration effect reveals a different physical reality inside the cell. As fluid floods the intracellular space, the volume forces the cell to physically expand, pulling the internal web of structural protein fibers, the cytoskeleton, taut. This physical expansion creates intense mechanical tension across the cytoskeleton. The cell interprets this specific mechanical pressure as a direct signal to initiate tissue growth. Cytoskeletal tension directly activates the mTOR pathway, the master genetic regulator of muscle protein synthesis, which begins assembling new structures. This same swelling pressure signals the cell to block catabolic pathways, halting muscle protein breakdown. Hydration acts as the primary mechanism driving tissue growth, converting mechanical swelling into an anabolic signal. Evaluating the complete pharmacokinetic architecture dictates a precise approach to supplementation. This split-screen diagram highlights the contrast. The baseline approach on the left, fasted ingestion with plain water, actively confronts closed SLC6A8 gateways and AMPK suppression. The optimized biological context is systemically hydrated, sodium-supported, and insulin-primed. This state ensures rapid transporter saturation, double intracellular hydration, and mTOR-driven anabolism. Increasing the amount of powder in the shaker cup cannot overcome an unprimed cellular environment. Maximizing creatine efficiency depends on architecting the precise electrochemical environment of the cell waiting to receive it.